is Sabrina, and I will be your nurse for this evening.
Hey, how are you?
Good, how are you? So I'm going to provide privacy and wash my hands. So I'm going to close the curtain, and I'm going to wash my hands. Can you please state your name?
My name is Steven Ginsberg.
Perfect. And can you please state your date of birth?
June 2nd, 1993.
Perfect. And it matches. Can you please state the year that it is this year?
2020.
And the president, please.
Donald Trump.
Good job, good job. Okay, so vital signs were actually checked by the CNA and they all were stable. So next we're going to assess the mood. Is that okay?
Sure.
Okay, so it seems your mood is pretty good. You're pretty in a good mood. Okay, and on inspection, the patient appears very calm, very happy, and very appropriately dressed and taken care of. So now we're going to assess your pain on a scale of 0 to 10, 0 being no pain at all, to 10 being the most pain you've ever had in your life. Where would you fall?
0?
Perfect. Okay, that's good to know. Now I'm going to assess your scalp. Is that okay?
Yes.
Okay, so I'm going to go from behind, and I'm going to palpate the scalp. All right. So the scalp is okay. The skin is dry and intact. Even color is noted. He appears clean, no lesions. On palpation, there's even hair distribution, no patches, and there's no scars, lesion, and skin is intact and even color. So throughout the body, there's also no body odors that I have perceived. All right. So next I'm gonna assess your ears. Is that okay for you?
Sure.
Okay, so next I'm gonna take my light. I'm gonna assess your ears. All right. I'm gonna go to the other side. All right. Ears are bilateral and symmetric and no redness and no drainage. All right. Next, I'm gonna do your mouth and nose. Is that okay?
Okay.
Okay. I'm gonna next check your trachea and see if it's midline. Is that okay?
Sure.
All right. So the trachea is at midline. I'm gonna check your neck. All right, it's symmetrical. And next, I am going to go from behind and palpate your thyroid. Is that okay?
Yes.
Okay. All right. So, upon thyroid palpation, there's no nodules, no masses, no bulges, and no enlargements. Can you swallow for me one time, please? Perfect. There's no enlargements when he swallows. Next, I'm going to do the lymph nodes. Is that okay?
Yep.
Okay. Pause to start out. All right, so we're going to start here. This is the pre-auricular, the post-auricular, the occipital, the retropharyngeal. Here is the submental, superficial clavicular chain is right here, and then right behind it is the deep clavicular chain, and then our last one is the supraclavicular right here. And upon feeling they were non-palpable, so that is a positive result. All right, so next I am going to auscultate your carotid arteries. Is that okay?
Okay.
Okay, let me listen to them. So here we want to see the carotid arteries are equal, but they can't be bilateral, so I'm going to test them one at a time if that's okay. Okay, I'm going to use the bell of my stethoscope. Okay. I'm going to test the other side. Okay. So upon auscultating the carotid artery, there were no bruits found, which is a positive sign. So next, I'm going to palpate the carotid and compare it to the apical pulse, if that's okay.
Mm-hmm.
All right. So I'm going to palpate it, and right here, and they are even, which is good. That is a positive sign. So for the first cranial nerve, we are going to test your sense of smell. I'm going to put one sense of smell, and you're going to close both eyes, and you're going to tell me what that scent is, okay?
Okay.
All right, so can you please close both of your eyes? All right, so now I'm going to come, and you're going to tell me what the scent is.
Pumpkin.
Perfect, and I'm going to come on the other side, and you're going to tell me what the scent is.
Pumpkin.
Good job, good job. All right. So for the vision exam, the Snellen chart was completed prior, and it was stated that the patient right here, Stephen, has 20/20 vision, distant vision, and this was all completed by my CNA. Next is going to be cranial nerve 3, 4, and 5. Is that okay?
Yes.
All right. First, I'm going to have you smile and frown and blow your face like this. Shut your teeth very tightly together. Good job. Next, I'm going to do your cranial nerve 5, and I'm going to have you close both eyes again, and you're going to tell me when you feel something sharp, and when you feel something dull and soft. Okay? Can you please close your eyes? All right. This is cranial nerve 5.
Sharp.
Good job. All right.
Dull.
Good job.
Sharp. Sharp. Dull.
Good job. Your cranial nerve 5 is intact. So I'm also going to ask you if you could please tighten your jaw and close it. And close it. Yep. And now I'm going to move. Now try to move your jaw up and down. All right. No TMJ present. Perfect. All right. You can stop now. Thank you. Next, I'm going to test your cranial nerve 8. And for that, I'm going to go behind you and I'm going to whisper a couple of words. And you're going to tell me what I tell you, if that's okay.
Yeah.
All right, let me do that. I'm going to go behind you. Can you please shut your eyes? All right. You ready?
3, 2, 1.
Perfect.
Pink butterfly.
Good job. Cranial nerve 8 is intact. Now we're going to test cranial nerve number 9, and for that I'm going to have you open your mouth and say ah. Ready? Can you open your mouth, please?
Ah.
A little bit. All right, so the uvula is midline. Now I'm going to test cranial nerve number 10, and for that I'm just going to have you swallow. So can you please swallow? Perfect. Swallowing is good. For cranial nerve number 12, the hypoglossal, I'm just going to have you stick your tongue out and move it side to side. But for cranial nerve number 11, what I'm going to have you do is I'm going to have you lift your shoulders like this, shrug them both up. No, up and down. There you go. Shoulders appear symmetric. There you go. And now I am going to add some resistance on your shoulders, and you're going to try to push through it, okay? All right. So now try to push through it. All right. One more time. All right. So resistance was there. You could push through it. Now I'm going to assess your gait and balance. If you could just get up and just take a couple of steps, please. Thank you. Just walk that way. Thank you. So it's normal gait, normal balance. So now I'm going to ask you to walk heel to toe, like this. Good job. Good job. Thank you. So upon walking heel to toe, the patient was able and had a normal gait. I'm going to have you stick your arms out, and I'm going to have you like this. I'm going to kill you! Okay. Stick your arms out. Like this, pretty fast. All right, you can stop now. Fast movement is normal. Pronation and supination is normal. So next, what I'm going to have you do, this was a little tricky. I'm going to have you lay down, please. Thank you. And so this is called the heel to shin test. Put your feet up, and one foot's going to be long, and what I'm going to have this, bend your knee, please. Your shin is going to follow all the way down. Can you do that for me, please? One more time. Good. The cerebellum is intact. Perfect. The shin to heel test was good, negative for lower cerebellum test. So now I'm just going to inspect your chest. Is that okay? All right. Just going gonna check it out. Upon palpating, everything seems normal. On inspection, normal configuration and muscle development symmetry. Now I'm going to assess the skin integrity, color, turgor, and warmth and edema, and if there's any scars and lesions. So first I'm going to start with your turgor test. Is that okay? Alright, so I'm just going to pull a little bit of skin. Alright, no tenting present. Turgor is positive. Upon inspection, the skin seems warm and dry, even in color, and there are no scars and no edema. Can you please breathe in for me? And out. Thank you. And will you breathe in for me again? And out. Thank you. That was normal as well. Respiratory expansion was normal. The respiratory pattern and rhythm seem very steady. And now I'm going to oscillate the posterior breath sounds. I'm going to oscillate your breath sounds. Is that okay if I go behind you?
Yeah.
Thank you. All right. Listen. Take a deep breath in, please. And out. Take a deep breath in, please. And out. Another deep breath, please. And out. Another deep breath, please. And out. Another deep breath, please. Out. Another deep breath, please. And out. Another deep breath, please. And out. Another deep breath, please. Out. Another deep breath, please. And last one out. Oh, actually one more. Another deep breath. This is the last one. And out. Perfect. All your lung sounds posteriorly sound normal and stable. Is it okay if I oscillate from the front now?
Yeah.
Thank you. All right. Take a deep breath in, please, and out. 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 Last one. Take one big deep breath in and out. All lung sounds sound perfect in the anterior side. Just also take your lateral lungs. If you could just lift one arm up, please.
Excuse me.
It's okay to be tired during these. All right, take a deep breath in and out. Take a deep breath in and out. Take a deep breath in and out. Lateral side all clear. Next, I'm gonna listen to your heart sounds. Is that okay? Perfect. So I'm gonna start first, putting my stethoscope on, and I'm gonna start at the aortic, which is right here. And the aortic is in second intercostal space on the right side. All right, so I'm gonna start listening. That's okay. All right, and then I'm gonna move to the pulmonic, which is now on the left side, and it's also intercostal space too. So I am hearing, okay, so now I'm gonna go to herbs. Third intercostal space and the left sternal border, which is right here. And then right here, I'm gonna go to your tricuspid. And the tricuspid is the fourth intercostal space. So at this one, I'm hearing S1 is greater than S2. I didn't mention, but at herbs point, I was hearing that they are pretty equal. And at pulmonic, I would say that S2 is greater than S1. All right, so now we're gonna go to the mitral, which is the fifth intercostal space. Let's do this right now, just right here. All right. And I'm hearing that S1 is greater than S2, which is normal. Now, can I just use this? Can you just breathe normally? Just normally. right, heart rate is normal, 48 beats per minute. Thank you. All right, now I'm going to ask you a couple of personal questions and feel free to answer honestly. When was your last bowel movement?
10 minutes ago.
Awesome. So it looks like your system, everything is working. When was your last urination?
2 minutes ago.
And did you notice any coloring? Different? Any different color?
No.
And was there any pain? All right, thank you. Now I'm going to inspect your abdomen. If you can please lay down. Just going to be easier for us. All right, I'm going to start in the right lower quadrant. And I'm just going to keep on going up. Now I'm going to go to the left upper quadrant. All right. All right. There's no distensions, nothing hard. There's an obese curvature. So it seems like there's no distension of the urinary tract. And there is no scars, no ascites, no hernia noted. Thank you. Now I'm going to auscultate the abdomen in all 4 quadrants. Is that okay with you? All right. So what we want to listen to is just an active bowel sound, nothing hyperactive and nothing hypoactive. Okay? All right, I'm going to start listening. Great, everything sounds normal. You have an active bowel. I hear it moving. So what I found is bowel sounds present in all 4 quadrants, which is great. There is no aortic atrial obstruction, which is great. There's no stenosis of the renal function, and there is no stenosis of the iliac arteries, which are down here, which is great. Upon palpation in all 4 quadrants, there was no tenderness, no tumors, and no scars, and nothing was hard. It was all palpable. All right. You have come to your last part of your physical. How do you feel about that?
Feels great.
Good, you've been doing so well. Thank you. Now we're going to go and mainly focus on your lower extremities. Is that okay?
Yes.
Okay. So I'm just going to assess and look around on your lower extremities. I'm just looking for scars, looking for any edema. Everything is good. Skin is nice and moist. It's not too dry. No lesions. All right, no scars, and no skin breakdowns. It looks great. Is it okay if I check the range of motion on your lower extremities? All right. Let me know if anything's painful, if anything hurts, pulling. Just gonna lift up and down. All right, you can do that easily. Good. Just gonna assess with the other one. All right. Steven seems to be presenting with full range of motion, which is great. All right, for this one, I'm going to have you please sit up. Now I'm going to assess your deep patellar tendon, and I'm just going to tap it, and we're going to hopefully see a reflex. All right? All right, can you sit back, please, and have your feet hanging off the floor? All right, positive. And another positive. Thank you. So I would say upon deep tendon reflexes, I assessed 2+, and it was normal. And last but not least, we are going to assess your capillary refill. What I'm going to do is I'm going to push down on your toe and watch how fast the blood refills. Is that okay?
Yes.
All right. And can I assess on your other toe, please? All right, capillary refill, less than 3 seconds. Perfect. So I noticed I forgot DVT, so I'm going to assess that right now before I end my assessment. For this, can you please look all the way to the left? And now I'm going to shine my light, and it is less than 4 inches. There is no DVT present. Perfect. Thank you so much for understanding. Do you have any questions for me?
No.
How did you feel about this assessment?
Comfortable.
Perfect. Thank you so much, Steven. Have a nice day.
You too.